Being bloated after a meal is a feeling that most people experience occasionally. It can cause the stomach to feel swollen and uncomfortable, which may be accompanied by flatulence or burping. The abdomen can look larger than usual or be shaped abnormally. Persons may also have piercing abdominal pain. Yet, most times, the cause may just be indigestion or gas building up in the stomach and gut. A doctor can diagnose the cause of bloating and may advise that the person changes their diet. Let's look at some of the causes of bloating, some foods that may help or worsen the symptoms, and tips to help reduce bloating in other ways. What causes bloating? Bloating is a feeling of fullness or pressure in the abdomen. Bloating can sometimes be visible in the form of abdominal distension, swelling. According to one 2000 article, around 15% of people in the United States may report bloating or distension. Experts have linked bloating to other digestive conditions. If a doctor is unaware of a link to a bowel or gastrointestinal issue, they may define it as functional bloating. Doctors do not completely understand the causes of bloating. However, some of the potential causes may include excess gas caused by eating certain foods, small intestine bacterial overgrowth, SIBO, fluid retention, constipation, food intolerances, such as lactose intolerance, psychological, stress, irritable bowel syndrome, IBS. Another study indicates that bloating may also be present if someone has another condition, such as celiac disease, hypothyroidism, or diabetes. Foods to eat. Depending on the underlying cause of bloating, there are a number of foods and supplements to try that may help reduce it. The fiber in plant foods is essential for having regular bowel movements and preventing constipation, which may cause bloating. Some fibrous foods contain fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, FODMAPs. FODMAPs are short-chain carbohydrates that ferment rapidly in the digestive system. Some people have a sensitivity to foods containing FODMAPs, which can cause them to become bloated. If a person is avoiding FODMAPs, they need to choose which fibrous foods they eat carefully. People should also make sure that they are adequately hydrated to prevent constipation. Probiotics are live bacteria and yeasts present in the gastrointestinal tract that experts have linked to a host of health benefits. Probiotics are also present in certain foods and supplements. Some research indicates that probiotics may reduce bloating in some people with IBS. People can try eating foods that naturally contain probiotics, or they could take a probiotic supplement. However, this may not be effective for everyone. One 2018 study suggests a possible link between taking probiotic supplements and experiencing symptoms of gas and bloating in people with SIBO. Some foods that naturally contain probiotic bacteria include natural yogurt, sauerkraut, kimchi, kefir, miso, tempeh, kombucha. Ginger is a home remedy for many gastrointestinal complaints, including indigestion, nausea, and bloating. Some research indicates that it has anti-inflammatory properties and may help regulate digestive processes. However, scientists need to conduct more studies to confirm this. People can try making a tea with fresh ginger root and hot water to see if it relieves bloating symptoms. Which foods to eat and avoid depends on the cause of bloating. However, avoiding foods that can cause excess gas may be a sensible approach to alleviate the symptoms. People should also make sure that they have regular bowel movements and support their beneficial gut bacteria by following the tips above. FODMAP foods. Foods containing FODMAPs can cause bloating in people who are sensitive to them. FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Low FODMAP foods are low in these substances. Higher FODMAP foods include fruits, vegetables, dairy products, grains, legumes, sweeteners. The low FODMAP diet is not a long-term diet plan but a way to identify and substitute specific foods that may worsen symptoms. Experts do not recommend following this diet for more than 6 weeks due to the risk of nutritional deficiencies. Carbonated drinks. Carbonated or fizzy drinks may exacerbate excess gas and bloating. People should try to avoid these beverages to see if it improves their symptoms. Similarly, any beverage with added sugars, or even fruit juice, can ferment in the intestine and cause excess gas. Other tips. One study recommends trying relaxing breathing exercises, yoga, and meditation to relieve IBS symptoms, including bloating. If someone has persistent or regular bloating, they should contact a doctor. The doctor may prescribe laxatives for someone experiencing constipation or antibiotics for someone experiencing bacterial overgrowth. We talk about the importance of the gut and gut health in my book, Self-Care Advocate, which is freely available to download or purchase using the link below. Also, check out my Self-Care Advocate course if you're looking for a holistic solution to help with bloating or improve your gut health. If you found this information useful, please like and subscribe. Check out some of our other videos. Thank you.